Very much. It's Women's History Month, a time to celebrate women for their contributions and achievements. But for many of us, part of success is good health. And historically, there have been gaps between men's health and women's health treatment.
Some gaps still exist today. CBS 7's Hannah Brock met with two Permian Basin health professionals about women's health and got their tips. She brings us more from those conversations. Hannah?
Well, Dr. Katie Hutton says her female patients often put themselves last on the checklist as they take care of their families and work to excel in their careers. She says routine care and education should be a top priority. Obvious differences in organs create health differences between the sexes, but women often present unique symptoms for common health issues.
Things like stroke and heart attack, the discrepancies come in how the disease presents itself. A lot of women present with what we call atypical symptoms of heart attack and stroke. We call them atypical, but they're really just not the same symptoms men present with.
Hutton pointed to the past. In 1977, the FDA banned any women considered to have childbearing potential from participating in clinical trials. However, that changed in 1993 when Congress wrote a law requiring the inclusion of women.
And so the things that we're taught as physicians in medical school are based on research done on men. And so a lot of times we're not taught how to diagnose these things in women, and that's why they're called quote unquote atypical symptoms, even though they're very typical for women.
That's part of the initiative to fund women's health research at the Laura W. Bush Institute, housed within Texas Tech.
General health is not necessarily women's health. Women's health is a little bit different. We are doing kind of the research now to understand that.
One part of filling the healthcare gap is education. Hutton said many women aren't sure what routine care they need, like annual cervical and breast cancer screenings. Catching these conditions early is important.
Getting that screen and making sure that you're okay. If for some reason, something comes back abnormal and you're not okay, if you catch it early, then it's more than likely going to be treatable and you're going to be okay.
Dr. Hutton recommends creating a close relationship with the doctor. For pregnant women receiving routine care, she suggests taking advantage of that for long-term care. Those who struggle to pay for routine care can find help through Odessa Regional Medical Center's partnership with Pink the Basin. For CBS 7 First Alert News, I'm Hannah.